Hi guys, I'm Amrut Deshmukh, your booklet guy, and I'm with physio Dr. Hemal Sanghavi, and we are sitting in this beautiful garden in the premises of Midway Home. Namaskar ji.
Namaste.
Uh, Tell me, why Midway Home? Why this concept of Midway Home?
Uh, See, in India, there are very few rehabilitation centers. In the hospital, you get all sort of treatment. They treat stroke patients, ortho operations, spinal operation, tumors, neuro treatment, all sort of treatment. Okay, but once they get treated, what after that? Okay, still patient face lot of difficulties. Patient cannot walk, cannot do his daily activity of living. Okay, eating, grooming, dressing, or even cannot go to washroom. Okay, so once they get treated for their basic problem, then they come to us, then they come to rehabilitation center, where we treat them the way so they can gain their activity of daily living, okay, back again, like dressing, combing hairs, walking, eating by their hands, okay, or their occupational related activities, or their some personal choice, like if they want to go to movie, okay. After stroke patient, they find it difficult to go out of house, okay. So we help them to regain their life back.
अच्छा इसलिए शायद वो जो टैगलाइन है आफ्टर हॉस्पिटल बिफोर होम
Yes sir, yes
दैट्स
sir.
एग्जैक्टली द
Right.
gap that you are trying to fill
Right,
up in
we
the
are trying
patient's
to
life.
bridge exact that gap. Patient is fit to get discharged from the hospital, okay, that emergency condition or the problem what patient had faced, okay, that got treated by the doctors in the hospitals. But now what after that? They are not fit to go home. They are fit to get discharged, but they are not fit to go home. So there are many things yet to improve. So that gap we bridge.
Yes, yes, yes. And once they get discharged, it is not necessary that the family members will be are capable enough to take care of theirs. Yeah, physiotherapy तो वो दे नहीं सकते उनको.
Right sir.
And that's
Right,
why.
sir.
So can I call Midway Home as a hospital?
No sir, this is not the hospital. This is a rehabilitation center.
Okay.
Yes sir.
Okay. Good. So what kind of patients usually come here?
Uh, we treat all adult patients who requires rehabilitation service, like neuro patients, ortho patients, spinal patients, bariatric surgery after bariatric surgeries, or geriatric patients, even psychiatric illness patients. Not for the psychiatric rehabilitation, because of the various issue, the joints are stiff, the strength is low, the mobility is less. So we try to motivate the patient and we regain their mobility, and again we make them walk. Again we make them put back into their family, society, community, even their occupational role.
Okay. Can you share one case of patient's case which you are most proud of?
Uh, there are various patients. Okay, if I see last year, okay, we have treated many patients. I'm proud to say that more than 90% patient we have given results. They had come on wheelchairs, stretchers, and they went back on their feet.
Wow.
Okay, so we feel very proud by helping them this way. One special case I would like to mention. Of course, I won't take the patient's name, but he was a manager at some multinational company. He had stroke, so left side was completely paralyzed. And when he had arrived after hospital getting treated for the stroke, when he had arrived to our center, the left side was not moving at all, not just a centimeter also. And on top of that, he had multiple other complications. Okay, and one bigger complication what we faced was his alcohol withdrawal symptoms. He was very alcoholic patient before stroke. Okay, so he used to curse us, he used to give bad words to us, he used to punch us, kick us. But we started treated him, and I would say within 1.5 to 2 months, he started walking. He went back for a month. After that, he did work from home, and then he's joined his work back as a manager post.
Wow.
Now he's handling maybe more than 50 people under him, and no one believes that he had a stroke.
Super, super. So I'm keen to know about your educational background and experience, expertise in this field?
Yeah, sure. Myself, as you mentioned, I'm Dr. Hemal Sanghavi. I'm physiotherapist. I have done my bachelor's and the master's in physiotherapy. Even I have done master's MD in acupuncture. Uh, I have experience in physiotherapy and rehabilitation field more than 15 years. At multi-speciality hospitals like Bombay Hospital, Sefi Hospital and various other hospitals.
Okay. What kind of help you are looking for such kind of people? Is there any gap that you wish people can come forward and fill it up?
See, in India, as I mentioned earlier, rehabilitation is a lacking concept. Okay, no one believes. They are not much aware about the rehabilitation. That yes, something is available. That after stroke, after spine surgery, after ortho surgeries or any other problem, they can come, they can get treated, and they can go back. Okay, so because of the lack of awareness, many people they are not opting for it. Okay. There are various rehab centers, the small rehab centers. Never matter where you go, the bigger or the smaller one, but you should go to the dedicated rehabilitation center, the where the doctors are genuine, okay, the therapists are genuine, where they treat you properly. So, if we increase the awareness, okay, I would like to mention that, emphasize on it, that if we increase the awareness about the physiotherapy and rehabilitation center, we can directly impact on the quality of life of those patients who are suffering.
ओके ओके। ये एक सेक्शन में मैंने कुछ इक्विपमेंट्स देखे जहाँ पे लॉक है, चाबी है, कुछ स्क्रूज रखे हैं,
Right, OT table.
वेलक्रो है।
Yeah, OT
So
table.
ये हाँ, तो ऑक्यूपेशनल थेरेपी वाज अ कम्प्लीटली न्यू टर्म टू मी। ये
Right.
होता क्या है और वो यहाँ पे क्यों है?
Right. See, occupational therapy is one of the part of the rehabilitation. There are various professional comes under the rehabilitation umbrella. Okay. So, the physiotherapy, occupational therapy, speech therapy, dietitian, rehabilitative nurse, caretakers, okay, psychologist, counselor, neurologist, orthosurgeon. So, it's a big team. It's a team approach. Okay. So, what table, the machine what you saw, okay, it is a OT table. So, the occupational therapist specially works on patients. Simply and in short way, I'll say this. They work on their hands more. Okay, they are specially dedicated for their hands activity, and they try to put patient back to their vocation. Okay, because whatever we do, grasping, prehension, everything, all hand activities, without that we cannot do any job
Yes.
or any work.
अच्छा अच्छा।
So, they dedicatedly concentrate on that domain, okay, and they try to put patient back to their vocation, their job skills,
राइट।
again back to that job.
वंडरफुल। मतलब फॉर एग्जांपल अगर कोई सॉफ्टवेयर इंजीनियर है और उसको पैरालिसिस हुआ है तो उसको बैक टू मेक हिम कैपेबल इन हिज प्रोफेशन बैक अगेन
Yes.
ही शुड बी स्टार्ट
Is right.
वर्किंग ऑन द कंप्यूटर, तो आप वो उसको भी सिखाते हैं।
Yes.
What are your future plans? How do you look at Midway Home 5-10 years down the line?
Now we are serving to the adult population. We do all rehabilitation for the adult population. Okay, so we are aiming that we could help to more number of people, better way, in all the prospect, giving good service, even the giving good results. Okay, and in future we would be planning for the pediatric population also. The same rehabilitation center where the patient can stay and opt all the rehabilitation facility under one roof for the pediatric population, for the children population.
आजकल मैं देख रहा हूँ कि यंग बच्चों में जुवेनाइल डायबिटीज़ के कॉमन केसेस हुए हैं, एंड बिकॉज ऑफ सेडेंट्री लाइफस्टाइल, पूरा दिन टीवी देखना या ऑफिस में बैठ के काम करना, तो उससे काफ़ी लाइफस्टाइल डिजीजेस देखने को मिल रहे हैं। तो इनके लिए आपका कोई डू यू सजेस्ट एनीथिंग?
See, अभी का जो लाइफस्टाइल है, लाइफस्टाइल टेक्नोलॉजी ओरिएंटेड, द फूड हैबिट्स, okay, really those are actually harming us. Okay, even the global warming you say, or those are affecting our lives. अभी young patient में as young as 19 years, 17 years we are getting patients with stroke. Okay, So it was previously it was assumption that the stroke will be after 40 or 60. Now we are getting a stroke as early as 17 years, even below that. But we are serving the adult population, so we are restricted to 17, 18 age only. Okay. So lifestyle makes a lot of impact on your preventing the disease. Okay. If you are very active, if you are following proper food habits, okay, so many things you can prevent.
When we talk about rehabilitation center, तो यूजुअली दिमाग में आता है कि न्यूरो रिलेटेड पेशेंट्स होता है, तो क्या मैं सही हूँ?
You are partially right. Okay. Yes, we rehabilitation neuro related patient के लिए भी होता है, but rehabilitation सिर्फ neuro patients के लिए restricted नहीं होता है. Okay. Rehabilitation आप spinal patients का भी हो सकता है, ortho patients का भी हो सकता है, आफ्टर बेराट्रिक सर्जरीज, आफ्टर साइकेट्रिक प्रॉब्लम, और बहुत सारे बर्न केसेस हैं जिनको लॉन्ग रिहेबिलिटेशन रिक्वायर्ड है टू रीगेन देयर फंक्शन बैक, देयर एक्टिविटीज़ बैक. ओके, सो देर आर वेरियस अदर सेक्टर्स आर ऑल्सो देयर वेयर द रिहेबिलिटेशन इज रिक्वायर्ड.
वन लास्ट रिक्वेस्ट, अगर आपको कोई मैसेज देना हो.
श्योर. फर्स्ट ऑफ ऑल आई थैंक यू मिस्टर अमृत देशमुख फॉर गिविंग मी opportunity to speak on such a platform and motivating us and our patients here and our staff here. Just quickly, this is out of topic, but you are doing really great work. I admire your work.
Thank you.
One message I would like to pass to the society, that improve their daily habits. Okay. Like as you mentioned, the sedentary lifestyle, mainly two things, the sedentary lifestyle and the food habits. Second thing I would like to mention, that if you are getting problem, my first inclination is to prevent the problem. Okay, but still if you are getting the problem, then the second message what I would like to pass, do not ignore the physiotherapy and the rehabilitation part. Okay, because that will help you to gain your function back, to improve your quality of life.
थैंक यू सो मच हेमल जी, बहुत
Thank you.
मज़ा आया. एंड यहाँ पे जब पूरा दिन हमने टाइम बिताया पेशेंट्स के साथ, हॉस्पिटल का तो बिल्कुल फील नहीं आ रहा है. बहुत ही सुंदर एम्बियंस है और लोग भी बहुत फैमिली की तरह रह रहे हैं. सो थैंक यू सो मच फॉर गिविंग सच अ ब्यूटीफुल प्लेस टू मदर इंडिया. थैंक यू. ऑल द बेस्ट.
Thank you, sir. Thank you.